So yes, I finally did it. I actually had a Korean skincare clinic experience. So mine was a little different probably than what you may have seen from influencers. So I'll talk about my experience and how it differs from maybe expectations from social media, as well as what you should really look for when you get your own personal procedure in Korea. So first off, I actually had a personal referral to a skincare clinic, and it was run by a dermatologist. So I have a bunch of friends who are doctors, plastic surgeons in Korea, and I was referred to the doctor's clinic. They have a bunch of locations and they're actually run by dermatologists. When I made my appointment, I did have to pay a consultation fee, and I was, as far as I know, not given any special treatment at all. Like, in fact, the dermatologist I consulted with didn't know that I was a doctor. He knew that I was referred by a friend, but not that I was actually a plastic surgeon from the US. Consultation treatment itself was nothing special. I did meet with the actual dermatologist. So a lot of skincare clinics, they will try to be more efficient. You're gonna have a meeting with the patient coordinator and then the dermatologist. The patient coordinator meeting may take 20, 30 minutes, however long that is required. When you meet with the dermatologist, though, it's pretty short. Mine was the opposite. I didn't spend that much time with the dermatologist because I used medical terms, and he sort of figured out pretty quickly I was a doctor and had some specific areas of concern. But yes, I actually met with the dermatologist. There was no buffer, there's no patient coordinator from the get-go. The other difference was that I was actually treated by the same dermatologist. In a lot of Korean skincare clinics, yes, you'll be treated by doctors. However, the person that does your injections, your laser treatment, your medical device treatment, they're all different doctors, and a lot of them aren't dermatologists. They're basically doctors that are doing this as a side gig. At the clinic I went to, yes, the nurses were great, but also the actual doctors there are the actual consulting dermatologists that you meet with beforehand. I don't know if that's important to you or not, but to me it was important because I wanted to make sure that the dermatologist that saw me, talked to me, and examined my skin was the same one that actually did the procedure. So, after the dermatologist diagnosed me with a couple things, I did get 3 separate treatments. I have seborrheic keratoses, which I consider brown spots, possibly sun damage or age spots. You could look it up, but seborrheic keratoses are pretty common as we get older, and he recommended CO2 laser for that. I actually wanted to have better looking skin, although I've, according to him and according to me, fairly good looking skin. So I was looking forward to Regeron Skin Booster, which is, as you know, male salmon DNA derived product that they can actually inject just underneath the skin. He actually didn't recommend it. He says that I don't need it. So I did get skin Botox. In other words, Botox, maybe micro Botox injected directly underneath the skin to improve my overall skin quality, to make my pores close up. As I age, I can only tighten the skin so much. I thought that I would need something that would tighten the facial and neck skin. He actually recommended Ultherapy. So that is ultrasonic heat therapy that essentially tightens up the SMAS, the SMAS. We'll talk about that in a second, but those are 3 major treatments that I got. I'll describe the whole process and then I'll describe the actual treatments. After the consultation, I then was dragged away by the nurse who basically cleaned my skin, got a big facial, got a bunch of photos to document what I'm doing. Then she put numbing cream all over my face. That sat there for about a good 20 to 30 minutes, as well as, you're gonna love this, an IV drip of Demerol, meperidine. Now they call it something else in Korea because they get the product from Australia, but I had to look it up while I was lying down, and it is Demerol. So I did feel a little out of it. The Demerol was really for the Ultherapy or Ulthera treatment. And then I waited for the numbing medicine to kick in, specifically the numbing cream on my skin to kick in. And yes, I have never had it sit there for 20, 30 minutes. It was actually pretty numb. Finally, after the appropriate period of time, I was then brought to the treatment room where the dermatologist that did my consultation actually did my treatment. So the first treatment was Ulthera. So Ulthera is known to be possibly the most painful, non-invasive procedure out there. I did not think it was that painful. When they put the pulses on, I got 1,000 pulses, which is sort of a lot, but I am a man. I have a bigger head. I have bigger physical, like cross-sectional area to do. And he wanted to get as much maximal lift as possible and maximal tightening of my SMAS, the superficial muscular aponeurotic system. So initially it felt like a bunch of electrical shocks, like low, mild, not that painful. But as time goes on, it sort of adds up. It heats up, and the electrical shock and the heat hurts a little more. At its worst, I'd say it would be about a 6 out of 10 pain, but most of the time it's like 3 or 4, maybe more like 3 out of 10 pain. It wasn't that painful at all. So I was surprised, or pleasantly surprised, because it really didn't hurt. And the main focus was, of course, over my cheek, over my jawline, and in my neck area. Next up, I actually got the skin facial, Botox injected underneath the skin. Now, I didn't think this is that big a deal because I've had Botox injected before, like 3-4 times in my life. This hurt a lot. So even though I was on Demerol and I had numbing cream on for 20 or 30 minutes, I would say this hurt 6 or 7 out of 10, occasionally 8 out of 10. And I think it's because I had so many injections. I mean, I lost count. It was greater than 40 or 50. Tiny injections, raising a little bleb or little, what maybe you would call blister, just underneath the skin, all over my forehead, all over my cheeks, face, and along my jawline. So that's where I got them. Finally, I had the CO2 laser. So I had a lot of brown spots or seborrheic keratoses. And so he zapped a ton of them. I mean, I would say I lost count after 50. I'm guessing here maybe 80, maybe 100, but a lot of them. It felt like a very tiny needle that got very hot. So yes, sharp, and yes, painful, but not that painful. It wasn't that big of an area, it wasn't that deep. So I'd say, again, maybe 3 out of 10, 4 out of 10 pain. And that was the entire thing. I'm estimating it took an hour, hour and a half, but I don't really know because I wasn't looking at time. Also, I was a little drowsy from the Demerol. And unfortunately, I did not film it because I felt a little awkward taking selfie videos on getting the procedures. I was also underneath a blanket, so I really couldn't move my arms easily, and there was no one else to take a video. And I'm not certain if they would, but you know, it's always nice to show that actually I got the procedure. So afterwards, I got a facial, and basically it was to clean things up. I also got a bunch of hydrocolloid bandages, which are small, circular little bandages. They do help to heal. They're very popular in Korea. They're making inroads in the US because they're called pimple patches here in the US, but it's essentially the same product. I got a bunch of those over every place where I got zapped by the laser, as well as a couple places where I got zapped by Botox. And then I had sort of an ice pack placed on my face for about 15 to 20 minutes. And that was it. I did feel slightly drowsy or slightly out of it after the procedure was done, for about an hour or two afterwards. But during the entire procedure, even though I got some IV Demerol, which I didn't really want, but they sort of nudged me or pushed me to get it, the feeling I had was I was awake, but I was definitely drowsy during the procedure. And right afterwards, since I don't really do drugs or drink alcohol, the Demerol had a very strong effect on me, so it lingered for some time, even though it was probably stopped, you know, an hour or 2 or 3 before I actually left the place. Now, in terms of the aftercare, they definitely recommend protecting the area from the sun. They gave me a cleanser, a couple other products to help with the overall healing. They definitely strongly recommended additional hydrocolloid bandages over any area which there was a scab, which looked funny, which needed some wound healing. And so that I had to reapply every morning. I don't know if you can clearly see on this video, but I do have still a bunch of red spots around me. Those faint red spots did look like open wounds or areas where CO2 laser was done, but that was only 6 days ago. That was the interesting thing. It's pretty rapid healing, especially I think with all the optimal healing technology, and hopefully I'm a good patient and followed the instructions like they wanted me to do. Now, in terms of the pain afterwards, they did warn me in theory. It could be itchy, it could be painful, you can have slow healing, etc., etc. I actually did not experience any of that. So the pain levels that evening were 0 out of 10, and that was true the next day. So I felt very little to no pain. In fact, I felt pretty normal. In terms of itching, I really didn't feel any. I did have a bunch of circular bandages all over my face. The interesting thing was in Korea is a culture where if you're different, if you look different, if they really find you unusual, they will actually stop you in the streets and start talking to you. I guess these procedures are so popular or so widespread, no one ever batted an eye, despite the fact that I had like 50, 75 patches on my face. People didn't seem to care. People didn't comment. People didn't look at me. People weren't avoiding my look. They just thought that I was some person who just had a facial procedure. And that's pretty common. My friends did tell me that even patients who have rhinoplasty or breast surgery or facial surgery, you'll see patients walking around various neighborhoods in Korea where they're obviously bandaged up and nobody really thinks anything. Yes, they think you had a procedure, but they don't think that you're weird or unusual funny. That was very interesting to me. And of course, I had a follow-up visit, but that was just by video just to make sure that I was doing okay. So in terms of what I can translate to you, or what I recommend to you, is this actual entire skincare visit was more on the expensive side for a couple reasons. One is because I actually went where the dermatologists do everything. A lot of skincare clinics, you're gonna meet with the patient coordinator. Dermatologists still run these clinics, but they may only meet with you for 5 or 10 minutes. They typically don't meet for you for that long. And so the other thing is that the dermatologist may recommend a couple different procedures. They actually may be less expensive. The reason why is the doctors that are giving you these procedures are not dermatologists. no nurses can actually run the lasers, run the medical devices, or actually inject in Korea. So they have to be doctors. A lot of times these doctors are either in training, they're still residents, or they're doctors from other specialties, and they find it more lucrative to like work full-time or even like, let's say, 1 day a week at a dermatologist clinic running a laser. So they're still doctors. I still think it's very safe, but they're definitely not dermatologists. So the specific clinic I went to, the doctor's clinic, it's so non-tourist oriented that they actually did not have, they still don't have any translators on staff. And so I was fortunate enough to go with my friend. In terms of looking at a more legitimate skincare clinic, you should definitely ask if you can get the medical tourism tax or the tax actually removed when you leave the country. Korea has a program where if you get certain things done through medical tourism, when you leave the country, you have the actual proper receipt or invoice, and they will give you, they'll figure out how much you paid, they take about 10% off, and they give that to you in the form of, literal cash, or they can actually apply it to your credit card. That's key. I think that if you go to a non-regulated, not really properly licensed skincare clinic, they won't be able to give you the proper receipt, which has to be scanned, which actually on the way out from Incheon International Airport will get you 10% back. 10% back on, $1,000, a couple $1,000, even $500 is a lot of money. And so it'd be good if you can actually get that back. So we'll see if I look even more sexy than I do currently, just post-op day 6 or post-procedure day 6. But the actual procedure went very smoothly. And as I've commented in other videos, it was very efficient. I don't think it's common to get like all of these procedures done all at once. So I had the consultation in the morning, I was prepped, I got the actual procedure done like, golly, 45 minutes later, and I got 3 bigger procedures done all at one sitting. And I was done in a total of about 2.5 hours. That's pretty fast, that's very efficient, and I don't think that's very commonly done in the United States. And my dermatologist is great. So I strongly recommend the doctor's clinic. I went to the Sinsa location, and feel free to ask me any questions. You can see my immediate post-procedure results, which are scattered throughout this video, and I'll try to post more about what I actually look like over time, because it's only been just under a week. Thanks so much for watching this longer video. If you have any questions, let me know. If you want other videos like this or different topics, please let me know as well. Have a great day.